Welcome back to Talkline All Day, everybody. We're going to be talking a little health right now. A new migraine research offers hope for patients. More than 40 million Americans know the pain of suffering migraines. And new research from Stanford University is leading to a greater understanding of migraines that could lead to better treatment for sufferers. Here to break it all down is Allina Health neurologist, Dr. Sargun Walia, joining us. And Doctor, we appreciate you taking the time. Thanks so much for being here with us.
Thank you. Thank you for having me.
I just mentioned 40 million Americans suffering from the pain of migraines on a daily basis. What did this study find?
So this study is a really interesting new approach towards migraines. So typically migraines have fallen into the bucket of episodic and chronic in nature. That was designed based on the number of headache days any patient has. So the researchers from Stanford took a different approach. They tried to look on, they had 111 patients in this study, and they used advanced imaging such as MRI, and they calculated that data to transfer these patients into two groups based on the findings they saw on the brain.
Okay. Why is focusing on the frequency of migraines not exactly ideal?
So, so far till now, the number of 15 is used traditionally in a lot of treatments that we use for headaches. So more than 15 headache days a month makes you into the chronic group, and less than that is the episodic group. This number is important because this does influence treatment decisions and often insurance coverage for treatments that are available for these patients.
Okay. How does the study's classification help?
So the study made two groups called Cluster 1 and Cluster 2. So Cluster 2 had patients who had more disability for migraines, who had longer migraine attacks, and they had imaging findings that showed how different parts of the brain communicate with each other and structural changes. And Cluster 1 had patients whose MRIs looked very similar to healthy individuals without headaches. Their disability was lower, their headache attacks were smaller. So the interesting part was that both these groups had a mix of patients who qualified for episodic and chronic migraines.
Is there an important distinction to be made between headaches and migraines? What is that distinction people should be on the lookout for?
So migraine is a headache disorder, but it's much more than a headache. This is a neurological disorder in which patients have debilitating headaches and other features such as nausea, vomiting. They have light sensitivity, sound sensitivity, and this can be pretty debilitating in terms of patients' quality of life.
Are any individuals more prone to them than others?
So migraines does have some genetic variations, but a lot of times it's different triggers for different people, which could be hormonal changes, it could be stress, it could be other triggers such as food. So it varies for person to person.
My producer, Grace, she wanted to know, I know she was curious about this topic in particular. She mentioned Botox to me.
Yes.
It sounds like you've heard this question before. Was that something that was, obviously people use every day, but it was thought to help perhaps prevent headaches or migraines. Is that still a thing? Is it true? What should people think on the Botox front?
So a lot of people think about Botox as a cosmetic agent.
Right.
But it has a lot of more uses. It's been used for chronic migraines for more than a decade now. And for the right patient, Botox can help prevent long-term headaches and improve the quality of life.
You mentioned for the right patient.
Yes.
How do you determine who is the right patient for a Botox?
I think that's where this study plays an important role as well. So currently, Botox is approved by FDA for chronic headaches. People who have more than 15 days of headaches for more than 3 months, and 8 out of those 15 has to be with a migrainous feature. So if we just think about purely a number of headache days, so people who don't fall in that 15-day period will not qualify for Botox, unfortunately.
I'm sorry if I'm putting you on the spot here, but I did have a question about your sleep pattern and how it might affect headaches or migraines. Is there a connection there at all?
There is. So sleep has been known to be a trigger for migraines as well. People who have lack of sleep, your brain is in overdrive, you become hypersensitive, so that can initiate migraines.
Okay.
But not everybody gets it, so it's one of the causes.
What, or I should say, how soon could we see changes based on the study that Stanford University did?
So I think this study is the right step in the right direction, but it's in the very early phase. This had only 111 patients.
Okay.
It was only done at one center, which is the right thing to do. But before we see clinical changes, I think it has to be reciprocated in a broader term, in a broader population, and at multiple places before we can see the change.
I hate to ask it this way, but I know a lot of people watching might be thinking, well, how far away are we then really from being able to decrease the number of not just people who have migraines, but the people who do have migraines, decrease the days that they have to endure this?
Yeah, I think we are heading in the right direction, but it's hard to say that number.
Sure.
I think we are years from taking it away completely, but the research that we have right now and the treatments that we have right now, they're really good. There are newer agents out there by FDA that help both episodic and chronic migraines and different type of migraines. So I think we're leaning into the right direction.
When we're talking about this study from Stanford University, was there anything in the study that you read or saw or have come to know that stood out to you really that maybe you didn't anticipate or thought to yourself, that's really interesting?
So I think the most interesting part of the study to me was that when they divided them into different clusters based on the disability and not just the frequency, because right now chronic migraines are known to be debilitating, but in these groups, even in cluster 2 and 1, there was a mix. They didn't traditionally fall into all the chronic ones are going to be in the bad group or all the episodic ones are going to be in the good group. So that was the interesting part to me.
How much, if it's somebody like me who doesn't suffer from migraines, but every once in a while I get the occasional headache like everybody else. In terms of people who do suffer migraines, how much do you worry about them depending on medication, and how much medication should they take or try to avoid? What are your thoughts on that?
So my thoughts are, if anybody's suffering from headaches that are increasing in intensity, increasing in frequency, that it's not getting better by itself and it's taking your daily activities away from you, missing events, working your social life, work life, school life, you should talk to a provider. You should talk to a medical provider after that.
It's a fascinating study, and we certainly appreciate your insight on this. Dr. Sargun Walia, thank you so much for joining us here.
Thank you so much. It was a pleasure coming here.
Absolutely a pleasure having you. Really interesting study. Hopefully this is just the first of many that can help people get a little healthier along the way. We have so much more to come here on Fox 9 all day. When we come back, we'll talk a little NBA action. What a game we saw last night at the Garden between the Knicks and the Spurs. We'll talk more about that on the other side of the break. Stay with us.